In this presentation, we will review facial bones and sinuses, the parieto-acanthial and acanthoparietal projections, the Waters method. Image analysis guidelines for the Waters and open mouth Waters method state that distances from the lateral orbital margin to the lateral cranial cortices on both sides should be equal. The petrous ridges are demonstrated inferior to the maxillary sinuses and extend laterally from the posterior maxillary alveolar process. For the open mouth Waters projection, the sphenoid sinuses are visualized through the open mouth. For both projections, the bony nasal septum should be aligned with the long axis of the exposure field. The infraorbital margins are demonstrated on the same horizontal plane. The anterior nasal spine is at the center of the exposure field. The frontal and maxillary sinuses and lateral cranial cortices should all be included within the exposure field. Just wanted to review also a few positioning procedures. For the Waters projection, you're going to adjust the chin elevation until the mental meatal line is perpendicular to the IR. If you're performing an open mouth for the sphenoid projection, you're going to still elevate the chin until the mental meatal line is perpendicular, but just drop the jaw. The central ray is angled perpendicular to the IR so that it exits the acanthion. I have included the image analysis guidelines for your review. So let's talk about cranial rotation in the Waters projection. Just like the PA projection and the Caldwell projection, we're going to utilize the same anatomical landmarks to determine rotation. We're going to take a look at the lateral cranial cortex relationship to the lateral orbital margin. If one side is greater than the other, then there is some rotation. Now, how do we determine the direction of the rotation? The direction the face is rotated towards will have the least distance. So in this projection, you can see that the right side has an increased amount of distance between that cranial border of the cortex and that lateral orbital margin. So the head is rotated towards the left side. You want to ensure that your mid-sagittal plane is perpendicular with the IR. So how do we know if we have sufficient chin elevation for the Waters method? You want to look at the relationship between the petrous ridges and the posterior maxillary alveolar process. If the petrous ridges are demonstrated superior to the posterior maxillary alveolar process, superimposing the maxillary sinuses, then we have insufficient chin elevation. That mental meatal line is not perpendicular with the IR. So we need to adjust the mental meatal line so it is perpendicular with the IR to achieve the adequate image. And again, we are looking at this image as just the opposite. We're looking at the relationship of the petrous ridges and the where they are in the sinuses and their relationship to the posterior maxillary alveolar process. In this case, the petrous ridges are demonstrated inferior to the maxillary sinuses and posterior to the maxillary alveolar process. In this case, we have excessive chin elevation. In order to correct this imaging, we need to bring that mental meatal line perpendicular with the IR to achieve the projection that we need to obtain. Also, when looking at this image, the maxillary sinuses are superimposed over the posterior molars, as you can see, and the alveolar processes. You can also see almost the foramen magnum. I mean, you can see that we have a hyperextension of the chin and neck. So we need to bring this down so that the MML is perpendicular with the IR. I also quickly wanted to go over the modified Waters view because it can be, it is performed in the clinic setting. So the difference is, and this is an open mouth, but mostly you will do a closed mouth. Very seldom have I seen anybody do an open mouth for the sphenoid sinuses. But it is important to know that you would do the open mouth for the sphenoid. But let's get back to the modified Waters. In this case, you adjust the acanthomeatal line so that it is perpendicular with the IR. We do this so that we can demonstrate the orbital floors to see if there's any fractures in the orbits or foreign bodies. A lot of times patients get sent over for a modified Waters and a lateral orbit view so that we can determine if there's any metal in the eye for a pre-screen MRI. Also, this place, the petrous ridges are demonstrated within the maxillary sinuses in a modified Waters because we don't have that mental meatal line perpendicular with the IR rather than inferior to those maxillary sinuses. The projection demonstrated here is a adequately positioned modified Waters projection. So let's take a look at this parieto-canthal projection practice analysis. We want to utilize our anatomical landmarks to determine rotation and appropriate chin elevation. So let's take a look for rotation. We're going to look at the lateral cranial cortex margin and its relationship to the lateral orbital margin on each side. The left side is greater than the right. And according to guidelines, the side with the least distance is the side that the face is rotated towards. So in this case, the face is rotated towards the right. Now we need to determine if our MML is perpendicular with the IR. So now we're going to take a look at the petrous ridges here and the relationship to the posterior maxillary alveolar processes. As you can see, the petrous ridges are demonstrated within the maxillary sinuses and superior to the posterior maxillary alveolar process. This lets you know that we have insufficient chin elevation to place that mental meatal line perpendicular to the IR. It could be an angulation issue with the central ray if you were performing this AP and you had to do it supine for some reason, but typically if you're doing a sinus projection, you should have the patient in an upright projection or upright position so that you can adequately demonstrate air fluid levels. So I'm going to go with we did not position the MML appropriately. So what we need to do is elevate that chin until the mental meatal line is perpendicular with the IR, and ensure that there's no rotation by aligning that mid-sagittal plane perpendicular with the IR as well. This concludes our presentation. If there's any questions or concerns, please feel free to reach out, and thank you for participating in the presentation.